Hey everybody, this is Joe Joseph, and this is the dailysheeple.com's news shot. I'm going to go to naturalsociety.com as they had a great article. Are some cancer doctors immorally pocketing money from patients? Interestingly enough, I was having a conversation with a colleague at work today about this very same issue, as we've recently had a mutual friend that has been diagnosed with cancer. And so, one thing that I often do with everything is you look for more than one information stream, meaning that it shouldn't just come from the mainstream media or mainstream associations like the, American Cancer Society, things like that. Now, while they provide some very, very good information on things, they don't give you all the information because no one source has all the information. So you really have to go out there and do a lot of research into this and other diseases. But one thing about cancer is that it is a disease that always evolves. It's ever evolving, and there's no one clear-cut way to just blanket cure it. I know a lot of people talk about and rave about, and rightfully so, the medical benefits of cannabis oil, because we've seen it help people with Parkinson's disease get their functionality and their life back. We've seen it help veterans with PTSD be able to handle their PTSD and get their life back. We've seen it cure cancer oftentimes, whether it be stage 4 melanoma or even lung cancer. It has been effective in treating that, but it's not every case. And the problem is, because there's not really a very good understanding of it, even though they'll say that they have a better understanding, they don't. They really don't. They don't know what and why it causes, why it evolves the way it does. They know certain things like keeping your body pH alkaline. That'll help. Doing treatment like cannabis oil. That'll help. Your B17, great documentary, A World Without Cancer by G. Edward Griffin. Check it out. Talking about the benefits of B17, vitamin B17 in your diet, and how it was engineered out of our diets. And a lot of people out there that have done research into cancer see the data actually points to it being a nutritional deficiency that causes it to grow. So there's a lot of things that go into this. But one thing that is just deplorable, if you ask me, are the doctors out there that needlessly give out and then overcharge for cancer drugs just to make a quick buck. Oftentimes, they diagnose people with cancer that don't have cancer at all. And then they treat them going through chemo. It's just the most immoral thing I can possibly think of. So Natural Society reports on this. And they brought up a New York Times article. It says, among cancer doctors, it's called the chemotherapy concession. At a time when overall spending on prescription drugs is soaring, cancer specialists are pocketing hundreds of millions of dollars each year by selling drugs to patients, a practice that almost no other doctors follow. And unlike other healthcare professionals, oncologists purchase chemotherapy drugs themselves, which are often discounted by drug makers. And then, of course, this can lead to doctors administering drugs at inflated cost to patients. And since the doctor receives a drug at a discount, it's called chemotherapy concession, where, quote, financial incentives exist for some U.S. oncologists in the prescribing of chemotherapy and growth factors for treatment-related anemia. And many want to end it. Because, in fact, the General Accounting Office discovered that doctors on average were able to get discounts as high as 86% on some of these drugs. Okay? Now, and critics noted that the kind of activity is contributing to the nation's high healthcare bills, because all the doctors are doing is taking that markdown and they're going to pocket it themselves. And then you take these doctors out there that have taken advantage of that and diagnose people with cancer that don't have cancer just to put them through chemotherapy to charge them for the treatment. It's unbelievable. And the doctors that get caught with this absolutely deserve the fate that they get. And oftentimes, it's life in prison, because you're basically murdering people. You're giving them a death sentence. And for what? to make money, and you don't think you're going to get caught? I mean, this is unbelievable. So this just goes to show you how much the medical profession itself has changed. How doctors who once used to take the Hippocratic Oath, by the way, they don't anymore. They used to take the Hippocratic Oath that put the patients before their own well-being. Obviously, that's not the case anymore. Go to the doctor these days and tell me, does your doctor have a good bedside manner? Because if they don't, you instantly know where they're coming from. And I know a lot of people out there are smart. A lot of doctors out there are extremely intelligent and may not possess the people skills because there's that imbalance, if you will, where they're super book smart or super intelligent, but they can't really associate with anybody. Yes, there are people out there like that. We know that. But as a doctor, that bedside manner is critically important. Your ability to connect with your patient is critically important if they're going to make it through, especially a disease like cancer. So if you go to the hospital these days or you go to a doctor, you often find that these new doctors coming out are like automatons. They're drones. And they got to see you. And, oh, by the way, they only have 7 minutes with you because that's what their productivity software is telling them, is that in order to make the money you want to make, you've got to see a patient every 7 minutes. And this is the basically run you through the assembly line type of thing. Give you drugs to treat the symptom and send you on your way. The hell with fixing the problem anymore. We don't have time. We don't have time for that. So we'll just throw some prescription drugs your way. And of course, we've seen the prescription medical complex, the big pharma, benefit handsomely from this. Because not only is there a huge increase in the amount of prescription drugs, but also a huge markup. And people will pay for it because here in the United States, we're under the assumption that that's just the way it is. But go to a country like Costa Rica or even go over to Europe. MRIs, $80. United States, $1,500. EpiPen, $60 down in Mexico, $600 here in the United States. It's highway robbery, and we shouldn't stand for it. Plain and simple. I'm Joe Joseph. This was thedailysheeple.com's News Shot. Feel free to comment below and visit our website at thedailysheeple.com. Have a great day, everybody.